Hi, I'm Dr. Jawetz from Tenafly Pediatrics, and today I'm here to talk to you about sore throats. Sore throats are probably one of the most common reasons for children to come to see the pediatrician, particularly in children between the ages of 3 and 15. Sore throats have many causes. The most common cause of sore throats is actually just viral illnesses. Most children will experience at least one viral sore throat over the course of any winter's cold and flu season. However, there are multiple other causes. In certain cases, allergies can cause sore throats, particularly through chronic postnasal drip. And then the cause that we're most concerned about in terms of sore throats would be strep throat. Strep throat is a bacterial infection of the tonsils which requires antibiotics to treat. So when your child has a sore throat, there are certain things that we will look for in the office, which sometimes you can actually see at home. A child who has a throat infection will often have a red throat. And many times they'll have pus on their tonsils as well. Typically a child who has strep throat will have a bright red throat with little red dots on the hard palate, which is the top of the roof of the mouth, as well as a thin coating of pus on the tonsils. However, it is very difficult, if not impossible, to tell the difference between strep throat and a viral sore throat just by looking. There was a study published in the New England Journal of Medicine in the 1970s that asked experienced providers to differentiate between strep throat and viral sore throats, and they found that the experienced providers were only able to get the answer correct in about 50% of cases. So in order to properly diagnose strep throat, unfortunately a strep test must be performed. Symptoms that your child may have when they have strep throat would include headache, stomachache, nausea and sometimes vomiting, fever, and of course sore throat. They may have some combination of these symptoms. They will not necessarily have all of them. Sometimes when your child comes in with a headache and stomachache, we may actually perform strep tests because we're concerned about strep throat, even if they do not have a sore throat. Strep throat is easily treated with antibiotics. The typical antibiotic that is used to treat strep throat is amoxicillin. In children who are allergic to children who are allergic to amoxicillin or who have had recurrent strep throats, we can treat them with other stronger antibiotics. In very rare cases, in children who have frequent strep throat, they may require a visit to the ear, nose, and throat specialist to have their tonsils taken out. However, in today's day and age, this is very uncommon. Scarlet fever is a form of strep, which is not uncommon. Many of you have heard of scarlet fever through the Little Women books, where a character actually passes away from scarlet fever. The scarlet fever referred to in those books is not the scarlet fever we see today. Scarlet fever is just simply strep with a rash. It's no more dangerous than regular strep throat, and it can be treated the same way with amoxicillin. Strep throat is typically contagious for about 3 days prior to coming into the office with symptoms, and it continues to be contagious until your child has been on antibiotics for 24 hours. However, generally, strep responds well to antibiotics, and after 24 to 48 hours on antibiotics, typically their fever is gone, and they feel much better, and they can return to school or to play. And that's all I have to say about strep.